Hello there and a very warm welcome to New Week right here on TV 47. My name is Leangari and our sign language interpreter tonight is Ann Wairimo. Remember, you can engage us through our social media platforms, that is TV 47KE on Instagram. And by the way, today the government confirmed coronavirus cases have risen by 8 to now stand at a total of 363. Now, with the daily updates on the coronavirus, it appears so much focus has been laid on the dreaded virus, forgetting many other issues that need urgent redress, such as gender-based violence. Well, tonight, New Week will seek to paint a picture to you, not just on coronavirus, but its impact on the strides that have been made on the fight against gender-based violence. My name is Leangari. Our sign language again interpreter is Ann Wairimo. You can engage us through our social media platforms, like I mentioned, that is TV47KE on Instagram, Twitter, and Facebook. However, here are the highlights tonight. Doctors decry alleged police harassment at night and when crossing guarded border points of the 5 counties where movement in and out was banned. Victims of floods and landslides in Chesogon in a desperate search for their loved ones who went missing when tragedy struck 9 days ago. And it's a self-relief for hotel and restaurant owners as the Ministry of Health announces plans to help proprietors reopen their business, albeit gradually. This and more tonight on New Week. And it is a green light for restaurants and eateries in the country to reopen their doors to customers after government gave a go-ahead, albeit within adherence to strict rules on physical distancing to prevent the spread of the novel coronavirus. Health Cabinet Secretary Mutahi Kagwe made the announcement today, even as the number of coronavirus cases in the country increased by 8 to stand at 363. Linda Alela reports.
From the work done so far is that we shall allow a few restaurants and eateries in selected counties that show the highest levels of health regulation compliance and the ability to arrange for employee testing to undertake minimal operations while maintaining measures that mitigate against the spread of coronavirus.
That announcement by President Uhuru Kenyatta on Saturday came as a sigh of relief for many restaurant owners in the country. And on Monday, Health Cabinet Secretary Mutahi Kagwe said although the establishments are allowed to operate, this time it will not be business as usual. They must stick to set restrictions in keeping with COVID-19 containment measures. Eateries and restaurants allowed to open from 5 a.m. to 4 p.m. 4 people for every 10 square meters and the tables spaced at least 1.5 meters apart. Limit of number of persons at a restaurant with a distance of not less than a meter from one table to another. Customers must have masks, wash hands and sanitize before entering hotel. Staff working at these restaurants during the stipulated hours must first be tested for COVID-19. Restaurants and eateries must install contact-free thermometer for mandatory temperature check. Self-service will not be allowed. All this in a bid to curb the spread of COVID-19 pandemic. CS Kagwe also allowed the restaurants to sell alcohol to customers taking meals in them, but affirmed that bars will remain closed until further notice.
We have also said that this is not a license to start opening pubs. It is not a license to start opening alcohol sale across the country. Alcohol shall only be sold with those having meals in the normal manner in a restaurant. We have not opened bars.
This even as the country has registered 8 more COVID-19 cases, 4 of them from Mombasa County and 4 from Nairobi, raising the total number to 363.
We now in this country have some 363 positive cases in Kenya, having today confirmed some 8 new cases.
Blood banks in the country have also been reported to run low, forcing the Ministry of Health to open donating centers across the country.
And well, health workers have decried what they term as harassment by police as they go about their business past curfew hours despite being protected by the law. At the same time, the health workers have raised a red flag on proliferation of face personal protective equipment that have already found their way in health facilities, thereby putting them at an even higher risk of contracting coronavirus. Aaron Kipkoech tells us more.
When the first case of coronavirus was reported in Kenya, the government encouraged people to work from home. President Uhuru Kenyatta announced a nationwide curfew, partial lockdown, and other containment measures in keeping with the scientific advisories to curb the spread of the deadly virus. Health workers were by default exempt from the partial lockdown and curfew. But it appears the police are yet to recognize health workers as essential service providers. A case in point is the continued standoff between doctors and police manning the border of Nairobi Metropolitan Region at Chania along the Nairobi-Nyeri Highway.
Nilitoka asubuhi mapema nielekea Kenya Hospital kufanyiwa dialysis sababu naendanga siku 2 per week. Hiyo ni Monday na Thursday. Na wakati nilifika mahali bari ya roadblock iko, hawakuweza kuangalia karatasi yangu ama nini, waliniambia tu nipiduke. Nikaenda hapo, nimepiduka mara 3, saa mara 4 ndio nimekuja nikasimama mahali nifikirie la kufanya.
Doctors who work in Thika and live in Murang'a are often blocked from moving to either sides of the police barrier.
Because when our doctors are stuck in a road barrier, we feel uncomfortable because the patients are waiting for them in the hospitals. We know that we have patients who had other diseases even before COVID came, and they need the doctor's care. So we are not happy when they are being held in a junction, when we are all fighting for this virus, which we cannot see. We would not want to create an enmity between security forces and the doctors and the medical fraternity.
The police want even the doctors going back home to have a written note from their bosses.
We are supposed to behave well. Yeah, but going like this, crossing the roadblock all the time, we will not allow that. And if it happens that you must cross, then your representative doctor will be telling us who is who. I think I'm clear.
KMPDU Acting Secretary General Chibanzi Machonda says that the police keep harassing health workers on their way to and from work, even after they identify themselves.
Unfortunately, the police are still acting with brutality and using excessive force. This is an act of hostility against healthcare workers who are deemed and are supposed to provide essential healthcare services. In view of that, as KMPDU, we have today morning resolved that for the safety and protection of our healthcare workers in that region, they shall go back home until such a time that the relevant authorities implementing this directive shall feel that doctors are important to serve Kenyans.
Machonda is also calling on the government to put an end to the production and distribution of fake personal protective equipment. The fake PPEs have since made their way into health facilities, and doctors fear they could be at higher risk despite their sacrifice in fighting the coronavirus.
And equally, we urge all healthcare workers to be extra vigilant, to report and reject any PPE that is of low quality, because this will pose a danger to themselves. The paramount issue here is the safety and protection of the healthcare workforce.
The doctors also want the police not to use quarantine centers as prisons for people who are arrested breaching the curfew.
If we overload the quarantine centers as we speak, the health workforce that is already strained will be further strained. It will be exposed. It will further be exposed to infection And we do not want a situation where those who are manning quarantine centers also undergo quarantine.
Aaron Kipkoech, TV47, Nairobi.
Thank you for that report, Aaron. Now, a building that was meant to be used as a dispensary in Elugulu, Busia County, has remained unutilized for over 13 years now. According to residents, the dispensary that never was has now become a den of social and criminal evils, claims that Busia County health officials deny. Daniel Ndembende has the details.
Locals of Imanga village within Butula constituency in Busia County are protesting against the stalled project of Imanga dispensary that was meant to be offering health services to them. For 13 years, the building has become a habitation for birds. Stolen cows are kept here before being transported, and all manner of vices take place here, including prostitution.
Jengo hili limeweza kutumika na wale ambao wanatumika kama wezi wa mifugo. Wameweza kuiba mifugo na kuficha hapa.
Nilikuja nikasafisha hii hospitali, mavu ndani ya mang'ombe na ya watu, mipira ya watu wanafanyanga usharati hapo, nikafagia. Nikafikiria wataleta daktari, hawakuleta.
Hii hospitali imekuwa ni lodging, hospitali imekuwa ni mahali paweze kupangia vile wataiba.
The locals blame the ward leaders for the neglect. Locals say their grassroots leaders have never bothered to press the county government to put the building into proper use.
Eneo hili limekuwa kama platform ya wanasiasa kuja kupata kura. Wanaitumia kama forum ambayo watakuja waambia wananchi wale wa kijiji hiki watafanya hiki na kile ili wapewe nafasi ya kuchaguliwa katika viti vya wanasiasa.
Mheshimiwa wetu mara hii ukikutana na yeye, story ni kwamba kesho hospitali itaanza.
The facility could be of great importance to the community of Elugulu ward and its environs, serving an approximate number of 5,000 people.
Hii zahanati kama ingekuwa ya kufanya kazi ati inafanya kazi, hata mgonjwa wangu hii madawa ambayo amemeza miaka na miaka, saa hii sasa hata angekuwa stronger than the way yuko.
Tulifanya utafiti, tukaona vijiji saidi ya 10 vingepata msaada, vingepata services kutoka kwa hii dispensary. Tukaangalia hesabu ni watu saidi ya 5,000.
However, the Busia Ministry of Health boss in Butula, Dr. Evans Sumbeiwo, through a phone call, has refuted claims that the facility has been neglected, saying equipment have already been procured and are waiting to be delivered.
At the moment, na equipment zimeshanunuliwa na county government, ambazo kwa store materials. Alafu ya pili kuna assessment imekuja tukifanya na maofisa wetu wa afya kuangalia mambo ya structural and other capacity. So kuna recommendation ambayo tulikuwa tunapeana na kwa ofisi ya chief officer wa health na MCA wetu.
Daniel Dembede, TV47, Busia County.
Elsewhere, the residents of Shinyalu constituency are decrying regular harassment by the Kenya Forest Service warders manning the Kakamega forest. A 25-year-old man was allegedly shot dead by the warders after he was found in possession of firewood from the forest. Mulindi Kari now reports.
It is alleged that Kevin Lithalia was whisked out of this house in the wee hours of Monday morning and shot dead. Reason? For being in possession of firewood from Kakamega forest without authorization.
Forest wenyewe wametunyanyasa. Hawa mama wakienda kwa msituni wanakuwa raped. Tawa askari. Wanakuambia usipotoa suruali tutaenda na wewe. Inabidi mpaka mama anatoa suruali. Wamama wetu wote kia hata hatujuka una ukimwi wako na nini. Hawa askari. Na ukipata kama hujatoa suruali watakuambia upatie 5,000 and above. Usipotoa 5,000 and above watachukua chang'aa na kuni watakata kimiti kikubwa hivi wakuwekee mpaka Shisasari.
Ambapo wamemua mtoto ambaye hana hatia. Ahusiki kwa askari wa forest. Ahusiki kwa forest chochote. Hana kazi ya kufanya kwa forest, hata mbao, hata kuni, hata nini, ahusiki. Pengine kazi ya nje anaweza.
Nikiwa katika harakati ya kukuja kwa njia, nikasikia mayowe. Nikakutana na vijana ambao walikuwa na umbwa. Mimi nikauliza shida iko wapi? Hawa vijana hawakunijibu. Mimi nikajijazia nikaenda katika stage yangu mahali nasimama. Ambapo nikisimama muda si muda nikasikia mlio ukipigwa juu, nikashangaa kwani ni tear gas ama nini imefanyika.
Mechoka. Patani mtu kufa. Mtoto wangu mwenye achomi makaa, mwenye aendi msituni, alikuja kuokoa mimi. Koko yangu huko kwa mpaka anakufa. Ndio huyu amepikwa risasi. Hiyo risasi mtuambie ilikuwa stray bullet ama ilikuwa ya lazima kuwa na mtu na kumulenga purposely? Askari sisi nani atatutetea kuua mtoto wetu hivyo?
Confirming the incidents, Area OCPD Robert Makau has assured the residents that investigations into the killing is ongoing and whoever is responsible will face the full force of law.
Mumetunyima hata kulima msituni. Mumetunyima hata kuokota kuni ile imemusetatude. Mumetunyima. Kwa nini mnatunyima? Na sisi tuiko Kenya. Tungali tu koloni. Ile inji yenye wakoloni wasungu walikuwa hapa. Tunasuiriwa kwa vitu zetu wenyewe.
Sheria mpaka itafuata mkondo. Au majina yote wale watu walikuwa kwa hiyo kisanga tuko naye, na kulingana na hiyo maneno kesi saa iko kwa mikononi ya watu wa CID. Statements zinaendelea kuandikwa. Bila maneno iliendelea, uchunguzi inaendelea, na nasema ni poleni sana kwa hiyo maneno imetokea.
Women from the area have also called on the authorities to arrest a wave of what they term as regular sexual harassment by the forest warders.
Tunataka serikali tutetee, mama tunanyanyaswa, mama hatuko kwa kaunti ya Kakamega. Hata nimesikia hapa Mr. Maremba akisema, Mr. Maremba please come out. Tukuchue vile mtakutusaidia. Nini askari hawa forest hata wa polisi wakikuja kushika watu wanasema tumeitwa. Yule mtu amewacha hiyo kisirani kuua mtu yetu na kuacha kisirani ya kusema ati wanatupikia simu. Akuja athibitishe. Kwa maana tena sisi tutauana wenyewe kwa wenyewe. Waache kuchafua watu machina.
Mulindi Kerry, TV47 in the county of Kakamega.
Well, very tough sentiments there from a Kenyan. Well, we want to take a short break. I just want to sample a comment here from Peter Wambugu. In the interest of time, we'll just sample the rest of them much later. So Peter Wambugu here says Nanyuki is tuned and he addresses the county government of Laikipia, and he says they are requesting publics to donate. How? Na serikali kuu inatoa misaada. That's Peter Wambugu. Thank you for that comment, Peter. Remember, you can engage us through our social media platforms. That is TV47KE on Instagram, Twitter, and Facebook. Also through the number on your screen. You can SMS us and tell us exactly where you're writing from. Remember, the discussion tonight on sexual offenses, they're said to be on the rise, especially during this coronavirus pandemic. So don't go too far. This discussion will be there right after this break. Stay tuned.
When it comes to pimple care, Acne's Creamy Wash contains multiple vitamins and removes excessive oil and dirt. Acne's Toner rejuvenates skin. Acne's Sealing Gel fights bacteria. Use Mentholatum Acne's for clear and smooth skin every day.
Hey, Sospitason, tumefutwa wote.
Yawa, pia wewe?
Tumeachiliwa.
Si pia wewe unaweza anzisha biashara yako?
Na hii economy venye iko tough sana.
But not too tough for Mwananchi Credit.
Tutafanya aje?
Si niko na 5 good cars. We can get a quick logbook loan approved within 6 hours.
Nataka kuanzisha salon na spa. Hii haitatosa.
Si tuko na title deed spare. We can still get more money using them. Get a quick approval within 6 hours using your logbook or title deed. Do not get stuck. Call Mwananchi Credit today. Si nilikwambia.
You are a big smart joke.
Mwananchi Credit. Investor in people.
Back. If you just joined us, this is New Week right here on TV47. Again, my name is Leangari. Our sign language interpreter tonight is Anwai Rimo. And before we go into the discussion tonight, let's just look at this story where residents of Chesogon at the border of Elgeyo Marakwet and West Pokot counties have taken it upon themselves the responsibility of searching for bodies of their loved ones who were swept by floods and landslides 9 days ago. 17 people are still missing and scores are putting up in temporary camps. The residents say they have been able to recover one body and some body parts of unidentified people who died in the rampage.
We arrived at AIC Church, one of the camps where hundreds of residents who are affected by the landslides have pitched camp. The living conditions are deplorable, to say the least. Nasalin Cherop lost her 12-year-old daughter in the disaster.
Kuna shida nyingi sana kwa sababu mtoto akipatikana alafu tusahau. Kama akipatikana tunasahau ameenda.
Cherop is among more than 300 people who have pitched tent here after being displaced by the landslides that left 18 people dead and 17 others missing.
Mtoto alikuwa mzuri sana hata kwa masomo. Hakuenda hata namba ya 3 4, namba 1 namba 2. Hata yule mtoto nilikuwa kwa moyo yangu niliona hata vitu yake baadaye atakuja anipeleke juu.
They fear that the coronavirus might catch up with them and spread fast in the crowded camp.
Kama serikali watupe hema so that tuhakikishe mambo ya social distance yamewekwa vizuri. Kuna kiwanja pale so that kama familia wenye waathirika waweke hema waanze kama familia ndogo alafu tusitishe mambo ya corona.
Charles Biwott, who lost his wife, joins the local search team with the hope of recovering her body at least.
Sasa mama alikuwa anapoteza mama tu, leo alikuwa anategemea mimi kwa mambo ya shule. Sasa nani naangalia watoto na mimi natafuta mambo ya biz. Sasa iko sita sana.
A few kilometers from here we find another group at Liter Girls High School also conducting a search. Joel Chelanga shows us a note from a local police where he reported his brother was among those who are missing. His body is yet to be recovered.
Waendelea kutafuta tunakaa kupata. Kutafuta hata watu wa Rangi Cross walikuwa pamoja. Paka chini karibu kario wakapatikana.
Most families cannot find peace without burying the remains of their loved ones to enable them get closure. Some elders say they might be forced to perform some burial rites according to the Marakwet tradition just to symbolize the actual burial should they fail to recover the bodies.
Tunasema ya kwamba mtu amekufa tunafanyia mambo ya desturi fulani wakati tumeona kichwa. Lakini sasa kama tumepata body parts kama mkono au mkuu ama mkongo ama nyama, hatuwezi kujua kama ni mtu na kama ni mtu ni mtu gani.
The situation in the area has made it impossible for people to observe coronavirus containment guidelines. According to the Rift Valley Regional Coordinator George Natembea, a total of 18 bodies had been recovered by the time of calling off the search. But locals say the number could be more. Calvin Chitwa, TV47, Elgeyo Marakwet County.
Now on to a discussion tonight. As the COVID-19 pandemic rages on, reports of domestic violence are said to be increasing around the world, with numerous women globally experiencing violence. The world was already facing a crisis, and now COVID-19 is exacerbating the problem. 90 countries in lockdown, 4 billion people now sheltering at home from the global contagion of COVID-19. Restricted movement brings with it another deadly danger of what appears to be a shadow pandemic growing of gender-based violence. Now, let me just introduce my guest tonight. Via Skype is what we will be doing. We'll be holding our discussion tonight. And of course, we have here Florence Machio, who is a campaign officer with Equality Now. Florence, thank you for joining us.
Thank you for having me.
All right. And we also have Rebecca Gitao, who is a psychologist working with Gender Violence Recovery Center. Thank you, Rebecca, for joining us.
Thank you so much for having me.
Of course, I must tell the audience that both of you are ladies who have worked very closely with women and girls. And of course, you do understand all the matters that pertain sexual violence, anything that has to do with gender-based violence, not just for women, but also for men. And I'm really happy to have you guys. I just want us to begin by looking at what the Cabinet Secretary for Health, Mutahi Kagwe, had to say about this issue not too long ago. And if my director can just play that clip right now.
There are increases in domestic violence in homes. And I want to make a special appeal to our religious leaders to also weigh in and intervene in this matter to counsel our people against these emerging trends. And to say that the stress level in our country is going to increase. You are going to be challenged in living in a way that perhaps you have not done for a number of years. Is a new normal that we are not used to in a lot of our homes. But I think that the way to look at it is a challenge to overcome. Let us not ventilate. Let us not use our spouses, our daughters, our sons. Let us not use them as a way of ventilating our stress.
Well, ladies, having listened to what Mutahi Kagwe had to say over there, I'll begin with you, Florence. What do you make of what he had to say?
Well, I'm laughing because he somewhat acknowledges that there is a problem, but he looks at the problem as only brought about by stress levels for people being locked down. What COVID-19 has done has just magnified the structural violence that exists and the inequalities that already exist for the most vulnerable in the society, including women, young people, and people living with disability. So these problems are endured even during peacetime. But what COVID-19 has done has exacerbated the situation, because now most people are living with their abusers. Most people are not safe at home, and therefore, even with the lockdown, they're not able to move to safety. Lockdown and curfew makes it even so difficult, A, to report, to move to a safe place. If you were to run to your mother, you cannot run there because you can't move. So all these things have just compounded an already existing problem, and made it so him looking at it in one way is not enough. We need to look at it with a bigger, a larger lens.
Well, Rebecca, let me hear from you. What do you make of this sentiments? I mean, Florence is saying the government is not looking at it as what it is, because she's talking about it being a bigger issue than it is right now, or how the government is seeing it. Rebecca, what do you think about what Mutahi Kagwe had to say?
I think I'll support Florence, and for sure this is what have been happening. But now again, the triggers have come. And when the triggers have come, now people are now locked down and they are triggered, and women are becoming more vulnerable, which they were, and now it is being now exaggerated. I mean, it is escalated up, and this is how things were even before. But now, because of these triggers, the problem seems to be big. And therefore, we need to address this problem from the root causes and not from a crisis point of view. Yes, we have crisis, but crisis is a contributing factor to what is happening. And that's why maybe we are seeing numbers are high and high. And actually, these are not true numbers. Remember, majority of people are not able to report even to the police or even to the health facilities.
Well, Rebecca, even before I go all the way to looking at the statistics and the numbers, the percentages, you've mentioned a very key issue there. Most people will not report when there's an issue at home where they have actually been violated. Why do you think this is the case?
Now, imagine you are living with this perpetrator, and this is the same perpetrator you want to go and report. And at this point, at this time of crisis again, you don't have anywhere to go. There are no shelters. Then you decide you stay with the problem. You stay indoors. Where would you report? And when you report, where else do you go? And that's why I'm saying we need to address this issue from a wider perspective.
So are we saying that the victims are usually very fearful in terms of coming out to say that they're actually being violated, they're being beaten or harassed, or, you know, whatever kind of gender violence that they're going through? Do you think it's because of fear?
You know, anytime there are crisis and there is emergency, there is always that mode of hopelessness. There is fear, there is tension. And so even thinking rationally becomes very difficult. And so you condone the abuse, because by the end of the day, you're so hopeless, you don't know what to do. And so you get along with the abuser, not that you want, but it is time of crisis. What else can you do? And you're hopeless. And that's why I will keep saying, when we address this issue, we have to address it from a wider perspective.
I want us to just let our audience understand why this is a very important topic to talk about today. And looking at the statistics there, the adult gender-based violence cases, we see sexual violence, higher form of violence in male and female. Of course, we are also seeing that sexual violence cases have dropped by 10%. That's January and February. And of course, also sexual violence cases amongst female have risen by 19%. That's between February and March. And of course, also cases of physical violence and almost constant for male and female. I know that this is not the first time we are having, you know, this kind of conversation going around globally about sexual offenses. I mean, when there was the Ebola outbreak, there were still cases of sexual violence, you know, being on the rise. So this is not really a new phenomenon, Florence, is it?
No, it's not. And I wish we could learn from previous pandemics. The continent has had the Ebola pandemic. There was the Zika virus. My worry is, if we take the example of Sierra Leone, after the Ebola pandemic, they realized there were so many young girls who were pregnant. Now, when they looked back, they realized there was a lot of sexual violations that went on. Now, of course, they didn't handle it very well, but I'm raising that issue to tell you that we should not as a country wait to see so many pregnant girls to confirm that we're having violations. We should learn from what happened during that time. There are guidelines that are available that we can use as a country to mitigate what is going on at the moment. We should ask ourselves as a country, if we institute a curfew, if a woman is violated, or a man or a child, where can they go? As the minister tells us to wash hands, to wear masks, to do social distancing, when he's saying the police are going to effect a curfew, he needs to tell us that this certain category of people, police should allow them to pass during curfew times. And also the police should be aware that there are certain situations or there are certain cases like sexual offenses. If I have been raped, I don't think I'll be running out of the house with a mask. You are running for safety. So all these measures need to be put in place having learned from the Ebola crisis and other crises, also just learning from other countries and what they are doing, like Ethiopia, New Zealand, France. We have very many good examples right now of what to do. So we shouldn't wait to clean after the fact.
The statistics we have today, ladies, are from the Gender Violence Recovery Center. And I'm very sure that Rebecca is very conversant with the statistics. Well, Rebecca, I know that some of these cases are really rising, especially during the night when no one can actually help a lady or a daughter or son to someone. What do you think that people who are found in these situations can do at this moment? Because it's at night. Who will help you? No one wants to contract coronavirus, so who will come to your aid? So what can they do?
Now, like we are saying, it's so unfortunate that no one is talking about these cases, and they are there, and no one is talking about what do I need to do. For example, in terms of sexual violence, and it has happened, and I'm supposed to go to the nearest health facility within 72 hours, and we are in a lockdown. Can the government put those measures and put like a disclaimer? When such a thing happens, you can, whether there is curfew, whether there is lockdown, you're supposed, because there are consequences if I don't go to the hospital within 72 hours. And therefore, because we are here, maybe we need to educate our people that if such a thing happens, whether there is curfew or anything, you need to take care of your health first. And you need to go to the hospital immediately. Now, cases of domestic violence, again, they're happening again at night when a husband is abusing the wife, or the wife is abusing. I think they also need to go and seek for help immediately. But I know the challenge would be, by the time I explain to the police where I'm going, especially in matters of domestic violence, because situation will be just go back home and sort it. And I'm going back home where there is violence. And therefore, for me, what I would look at is the government first owning and believing that issues of gender-based violence are real, and we need to follow guidelines, and it's something that we need. As we are giving guidelines on COVID-19, we also need to give guidelines on what do I need to do.
Okay,
do we even have shelters as a woman? Where do I need to go for a shelter?
All right.
When I'm abused as a man, where can I go that night? And what do I need to do?
All right, before we even go into the end of solutions and what they can do, I just want us to also have just a bit of insight into the cases as regards to children. Just some of those graphics running right now, if my director can just have them on the screen. But what I want to ask you, Florence, is Rebecca has mentioned something very vital. It is important for you to report this case very, very early. And as she mentioned, within 3 days. Why is this the case, Florence?
No, not even 3 days. I mean, for me, evidence is preserved when you present yourself to hospital. That's just the way the system is. Our law makes it my duty, if I've been violated, to make sure that evidence is collected, so that when I go to court, my case can be sustained. That's the way that our law is. So that means if I don't get to a healthcare facility and then swabs are taken and everything is taken, all my clothes I was wearing are taken and preserved for evidence, we will never know who the perpetrator was, whether it was the neighbor, the uncle, or the police. We will never know. So it is so critical that it is almost like an emergency throughout. And because we are in an emergency situation, we need an emergency solution for women and children who are being violated during this particular time.
You know, even as we talk about children, Florence, looking at those statistics, yes, sexual violence is said to be a highest form of abuse among females. That's under children. And then you look at January and February, cases dropped by 16%. Also, cases rose by 29% between February to March. Also, among male children, you find sexual violence cases rising by 125%. That's a very huge number. It's not really small. And then there's, of course, physical violence rise in female children by 31% between February and March. It's so unfortunate to know this is happening to children. children being defiled.
Exactly.
Just the other day, I was talking to you, Florence, and I think you mentioned that you had just gotten a call from a family that needed help. Just tell us, what is the situation on the ground right now? Because I know you've been dealing with some of these cases directly. Florence.
So, I mean, within just a week, I've had 3 cases, not a week actually. In a span of 3 days, there were 2 cases of domestic violence that I personally got involved in, and a case of a defilement of a 5-year-old girl. Now, in all these cases, in one case, somebody called the police came and said, we are focused on COVID, unless you have a court order, we cannot remove the perpetrator from this space. In another case, the family refused to take the child to hospital because they thought they'll get COVID. So there's a lot that the government needs to do in terms of messaging so that people actually go and get help. If you're going to sit with your child because you are afraid to get COVID when you get to a facility, then it just compounds a bad situation and makes it worse. So we need to hear a lot of messaging from government. Get your messages right around these violations, because we will still need a country when we are done with COVID-19. We do not want sick children. We do not want traumatized children after COVID is done. And not traumatized because of COVID-19, but because of what I'm calling a shadow pandemic that has come in because of COVID-19.
Well, ladies, I just want to take you through. I know, Florence, you've mentioned something very critical, that you find the perpetrator is still allowed to stay in that very home, and that means the violence continues. But it's very sad to see this happening in Kenya. And you look at some of the, European countries, you see in Quebec and Ontario, domestic violence shelters are deemed as essential services, literally. And of course, also in Italy, instead of the survivor having to leave the house of an abuser, prosecutors have ruled that...
lives.
Yes. So it means the prosecutors here have ruled that in situations of domestic violence, the perpetrator must leave the family home. While here in Kenya, the perpetrator is allowed to continue. What do you make of this? Should we adopt the same?
I am very... we gave an advisory note to government, different women's rights organizations, and we are giving recommendations that have workable solutions, which can go either way. We're saying, if there are places where there are no shelters, this private sector that are giving money to the COVID-19 fund need to also probably, if I have a hotel and it's not running because there's no occupancy, say I am giving in kind, I will give 10 rooms at Sarova or at Hilton Hotel that the police can use to shelter people who've been abused. But also we can flip it like other countries and say, if you call this number and we know you're being violated, the police will come, remove the perpetrator from the space so that then you remain at peace as somebody who is the victim, and also help you to seek the proper medical care. Well, so if we really cared about our women and children, we will do the right thing. We have good examples everywhere, and it's not difficult. If we have the political will, the way we have the political will to fight COVID-19, we will have the political will to fight gender-based violence.
Well, Florence, I want to shoot a question to Rebecca. Florence, you've mentioned something about the helpline just before we go to a break. And if you can just make it a little bit short, Rebecca, are there available helplines right now, platforms through which victims can actually get redress? I know you're working with the Gender Violence Recovery Center, and I'm sure you must have a helpline, or you must know 1 or 2 others that people can actually contact the center by.
Okay, like we have different helpline. We have the national helpline, the 1195. That's a national helpline that anybody can report. And what they do, they'll take the cases and they will refer them to the different service providers. We also have 116 for children, that anyone, and these are toll-free numbers, and we are still coming up with new numbers that we want also to give the government to spread out, because what we need to see different service providers. But remember, there is a challenge. Even as we talk about shelters and everything, there is also the issue of social distance, where maybe the private sector may not be able to to fund for shelters. What can the government do?
I'll hold you right there. I'll hold you right there, Rebecca. I want us to take a short break, and when we return, I'm sure that we'll be able to look at some of those solutions, what the government can do according to what you can tell, the necessary, the relevant officials on the way forward regarding tonight's topic. Well, I want to take a short break. Remember, New Week will be back shortly, and you can write to us in case you've been a victim, in case you have a concern that pertains to tonight's discussion. Write to us, tell us exactly where you're writing from, and of course also tell us your name and your concern. New Week will be back shortly.
Mount Kenya University takes pride in being an academic giant with some of the best infrastructure, imparting knowledge to the best brains in the country and the region. Our members of faculty are keen to deliver market-driven programs in science and humanities with a keen focus on linkages with relevant organizations. We admit both self-sponsored and government-sponsored students under the Kenya Universities and Colleges Central Placement Service. Join us today and train with the best to become the best. Mount Kenya University, unlocking infinite possibilities.
Welcome back. If you just joined us, this is New Week right here on TV47. Again, I'll just introduce my guest tonight. We have Florence Michio, who is a campaign officer with Equality Now. And of course, we also have Rebecca Getao, who is a psychologist working with Gender Violence Recovery Center. Tonight's discussion, of course, issues pertaining sexual offenses being on the rise, especially during this pandemic. A few of the issues we have highlighted, the fact that ladies do not have, the boldness to come out and address these issues or speak up if they are violated. And of course, some of these cases happening at night when really not many people can help you. Well, Florence and Rebecca, I know before we took a break, we were talking about the lines, the helplines that are available. I just want us to look at the government's response. What do you think the government should be doing? And before you even answer that question, Florence, what is the legal aid available for victims?
Wow. I might say almost none, but rely.
How would you say none?
I think survivor. Almost none, because I would want my government to help me when I'm distressed, especially because I'm a taxpayer and I'm a valued citizen of this country. So I would expect legal aid from government. But having said that, we have NGOs NGOs like FIDA Kenya, like CRU, like Kelin, that are offering legal aid for survivors. And I also know LSK the other day said they also support helping survivors or anybody who's violated or anybody whose human rights have been infringed. And I believe anybody who's been violated sexually, anybody who's been beaten, has undergone domestic violence, their rights have been violated. So we have organizations that are helping right now, but my recommendation, because now we are going to go into solutions.
Actually, I was going to ask you about the recommendations, friends, because I know you have an advisory note that has been written to government. I know not too long ago you told me that you plan to write to the president in relation to this crisis, so to speak. Tell us a little bit about what your recommendations are all about.
So our recommendation, now that I was talking about legal aid, is that the government should ensure provision of free legal aid and representation for GBV survivors in all counties, and ensure that they access justice for survivors and prioritize them in court. Ethiopia has done that. Ethiopia has been key during COVID to say we have special courts just for domestic violence and GBV. Therefore, cases are fast-tracked even in this period. Another recommendation within this is that when we received United Nations alert that GBV has gone up, court should handle domestic violence cases as urgent matters, not as matters that have to wait. Civil matters can wait, but anything to do with the Sexual Offences Act is a criminal matter, so it should be added urgently. And then in terms of medical care and treatment, ensure that survivors of GBV access medical treatment at all government facilities, and they should not pay. They should not be asked to pay like people who are being quarantined. This should be a service that is given to all survivors, and a referral network that is uninterrupted from police, to hospital, to shelters. And speaking of shelters, make sure we have shelters for every survivor, whether male or female or child. Make sure we have facilities. The government should be able to also allocate 30% of the monies they're getting from the COVID-19 response fund. 30% should be allocated to GBV prevention and strategy.
Florence, with these recommendations, do you foresee a light at the end of the tunnel? Perhaps you can, tell us.
If they do this, we will have fewer cases, and we'll reduce the work that Rebecca is doing, counseling people every other day because they've been violated. The few who've managed to get to GVRC centers. If these recommendations are taken by government, we believe that the people of Kenya will judge this government in a positive light, because they cared for the most vulnerable in society, women and children.
Yes. All right, Rebecca, I as much as we are also talking about waiting for the government to do something, what can I do? Say I'm the person who's going through consistent violence, whether sexual violence, physical violence. And by the way, this is not a matter affecting women and girls. We have to mention that it's also affecting men. So what are the available avenues of getting aid immediately at this moment, other than what you mentioned earlier, helplines? And especially on counseling, because I know some people probably need counseling. They need someone to talk to. Remember, during this coronavirus period, some of these people are not able to get direct contact to their families. They're not able to see them as much as they used to.
Now, before I say what you need to do, maybe I need also to interject to what Florence has said. And what I would tell the government, if they are going to own this data, if they are going to when they own it, they are going to put more action. So for me, I want to see them owning the data. Now, coming to the person, to the survivor who have been abused, as much as we are waiting for the government, I would advise and encourage survivors to shun away from feeling guilty and shame, because this is not about them. This is about the perpetrator. So about them is about their health. So whatever has happened has nothing to do with them, and they should not feel guilt, and the shame should not be, on them. And so they need to take the next step and report to the nearest health facility, especially for medical treatment and counseling. And if there is something that is very key now, is the psychosocial support. Because here we are dealing with a myriad of issues. There is the COVID-19 stress, and again here you've been abused. You can imagine that combination. And therefore there is emergency need of psychosocial support. Now we are having one challenge. You may come to the hospital the first time and get the first treatment and get the first aid psychological support, because that will be the first aid. You're supposed to come back, and there is all these restrictions of movement, and there is all these curfews. So sometimes coming back. And so we are advised to do the virtual counseling, which GVRC we are trying. But look at it in this way. Virtual counseling needs people who have, again, phones that can enhance that? Are all the survivors, would they have such kind of gadgets? A few of them.
Well, ladies, even as we come to the end of the discussion tonight, thank you so much for your insight into the matter, your recommendations, very, very strong recommendations there. And just as we come to the end, just briefly, I want you to speak to the perpetrators, because we've talked about the victims, but how about the perpetrators? Some of them, they're said to be behaving the way they are behaving because they have stress, they're having issues at home, they don't even know where to get money to put food on the table. Your final sentiments about the perpetrators. Florence, I will begin with you and make it brief.
Let me start with this. Let's not tag or peg anything to violence. So if we say they were stressed, meaning it's like we are giving them a leeway. All that I want to say is that the perpetrators, especially to children, are people close to them. So parents, let's take care of our children. And again, for perpetrators, it's about power and all that. We need to deal with ourselves and not deal with others. So let's deal with ourselves. Let's take care of ourselves. And even to ladies there and men out there, please speak out. Don't keep quiet. Speak out and take care of yourself.
If Florence is there.
I'm still here. I just thought I shouldn't waste a lot of time with the perpetrator, but I should focus. I would rather focus on helping the most vulnerable. And in this case, I'm also saying, and I'm talking to governors right now, that in your county, don't wait to see the numbers. Prevention is always better than cure. And then when we are doing cash transfers and we're giving food distributions, let's remember sanitary towels. Schools have closed, and most girls were getting sanitary towels from school. Now they are home, they're not getting sanitary towels. And this is also another avenue for abuse, number 2, for child marriage to go on, and even FGM to go on. This, for me, is so critical. I'd rather spend this moment to focus on that than the perpetrator.
Thank you so much, Florence. Florence, Rebecca, so good to have you. I love the passion that you ladies have for anything on gender-based violence. May you continue to do the great work that you're doing. That was Florence Michaud, who is a campaign officer with Equality Now. And of course, also Rebecca Guitar, who is a psychologist working with Gender Violence Recovery Center. So much feedback, by the way, but my director tells me I've run out of time. However, I believe we've gotten something to carry home tonight, something that has informed will inform our actions towards addressing all matters gender-based violence. Thank you for watching tonight. My name is Leangari. Our sign language interpreter tonight has been Anne Wairimo. Until next week, same time, same place for New Week. God bless.
The following program contains scenes suitable for adults only. Viewership is restricted to persons aged 18 and above.